Good evening and welcome all to our virtual event for UTC Sheffield Olympic Legacy Park. My name's Jess Stevenson. I have the pleasure of being principal here, and it's my joy to invite you really to have a virtual tour of what health, science and social care is about at the UTC. I'm only saddened that I can't have you here in our building and show you our fantastic facilities, and you get the opportunity to meet our students and staff face to face. I've been principal at UTC OLP since January, and it has been a turbulent year for everyone, but I can truly say that the staff and students have made me really, really proud to do my job. There's nothing more exciting than fostering a passion for a subject, and that's so true within the health, science and social care. I'm joined this evening by members of the health department and by members of my senior team, as well as by Cyril, who do our marketing, and they'll be helping facilitate this as that goes through. There's a question and answer session at the end. Please use the Q&A facility to ask any questions throughout the event, and some of them will be answered live as they come up, and some of them by staff or myself at the end during the Q&A. So please don't wait just to the end to ask any questions. Pop them up as you think about them. If we go to the next slide. Here you can see the agenda for tonight. You will be hearing from me. I'm going to talk a little bit about what it means to be a UTC and why we exist and why we're a bit different and the same as other schools. But actually, I'm not going to dwell on that for too long. We have another virtual event that ran earlier in the year where there's a recording of, which is much more general about that. So if that is something that you've come not knowing about, my recommendation is that you go back and watch that so you can understand more about the ethos and what we're about. Most importantly, the things you're going to hear from are from some of our fantastic students, from my staff and from ex-students, as well as one of the things that's kind of at the root of a UTC, which is from some of our employer partners. What I will say about the employer partners is, particularly with health, one of our massive partners is obviously the NHS, and we are really mindful at this time of placing any extra burden on the NHS. In a normal event, you'd be hearing from them and how we work really closely with them, and there are still plans to do that, and they are still very much core partners to us, and they sit and representatives of the NHS sit on our governing body. However, as you can understand, for this event, there are many other bigger things going on in the world which are rightly their priority. Can I have the next slide? Okay, so why do UTCs exist? We exist to specialise, to be employer-led. We are very much about the skills for the future. So at UTC Olympic Legacy Park, we aim to be a pipeline in order to create the workforce of the future, not only for jobs that exist now, but for future jobs. There's a digital revolution that's changed what we need, and we're here very much community-based, very much based in what is the need of Yorkshire, of Sheffield and South Yorkshire. And our students come from the Sheffield area, but down to Chesterfield, up as far as Wakefield, Barnsley. We've got lots that come from Rotherham because we've got a bus that comes straight in from Rotherham, so it makes transport easy, right over into the Peak District. Next. Okay, so UTCs are more than just a school. We, as well as providing strong grounding in the core subjects of English, maths and science, and we really do get fantastic outcomes for them, and we've got really strong departments. Each UTC has one or more technical specialism linked to industry partners. The curriculum provides a blend of academic and technical learning with a balance to the appropriate to each key stage and really the age of the students that are taking part. Programmes of study demonstrate high academic and technical ambition for all pupils, building on the virtual employability skills, personal values and professional behaviours required by UTC learners for rapid progression into the UTC's target technical sectors. In this case, talking about health, social care and all of those fields, which is such an enormous range of jobs, from everything from kind of lab technicians right through to the caring industries, all of which requiring slightly different routes. UTCs invest in young people's enthusiasm and aptitude for science, maths and technology, and in doing so accelerate their progression into a career in the technical field. In turn, this progression will feed the talent pipelines for the UTC's target technical sectors. We are on the Olympic Legacy Park, and next to us is the Advanced Wellbeing and Research Centre. We are really in the hub of kind of research and innovation around health and wellbeing. Can I have the next slide? So, so our specialisms are health science, social and social care, sports science and computing. Now, while they are distinct specialisms, and Miss, if you keep clicking through, there's an additional slide. While they are distinct specialisms, they are actually mutually complementary, and you'll often find that there's some really exciting careers in the hinterland between them. So exciting careers that overlap between digital health, between sports and health, and there's obviously complementary fields that are there. So while each of our students who come in very much with the idea of a sector that they want to work in, it is not there are lots of possibilities for exciting extracurricular work that we do. And the next slide. So when we think about our curriculum going through, we've got a core curriculum from year 9 to 11. Every student chooses a specialism. In this case, we'll be talking about the health sciences and social care. That is complemented by GCSE maths, English, science. All students do triple science, and then in year 11, a decision is made about really whether it's the combined, which is the 2 GCSEs, or the triple is the best option for that student to open the most doors. But we're here to talk mainly about the health sciences and social care. They do the level 2 Cambridge National in Health and Social Care, and that's studied in year 9 and 10. Then into year 11, there's students get a choice about whether they do their what we call the professional qualifications. These are the qualifications that other schools don't often get the opportunity to do because they're tied into things like the baccalaureate and into Progress 8 measures, which us as a UTC, because our focus is about an employer route and employer channels, we're not tied into those, which enables us and is really liberating for me as a head teacher to be able to choose qualifications that best match not only what our industry partners want and need in their employers, but also what our students need. So in health, in the health pathway, students in year 11 will choose either to do the level 2 award in relationship, sex and health education, or the NCFE level 2 award in preventing and controlling infection, which is particularly relevant at the moment. If we move on to the next slide, I can talk briefly about the post-16 offer. So at post-16, on a Tuesday and the Thursday, students choose to have what we call their specialism days. And this is the Cambridge Technical Award. And this comes in varying sizes, as you can see on the screen. So it could be that students choose to do the smaller route. So it might be, say, the foundation diploma and 2 or 3 A levels alongside that, or they may choose to do a larger health and social care qualifications, such as the extended diploma with just 1 additional A level on its own, or with the applied science route. That route is very much for the kind of health and social care options. If a student is looking to do more of the kind of laboratory work or the chemical work, but you know, the kind of chemistry side of medicine, or look to go into straight medicine, they might choose to do either this as the smallest qualification, so as the certificate in order to get some of those care values that underpin it, or they may choose to do the applied science where you've got the laboratory skills that are there, and then look at a core A level offer. We have lots of students that do different pathways on that, each very much dependent on where they want to go at the end. We do lots of careers work right from year 9 all the way through post-16 to make sure that what students are studying and the skills that they get really will lead them into those top destinations or those apprenticeship routes that are the ones that they want to do. So later on, I'll talk to you about where some of our graduates have gone, and you'll get to hear from some of our alumni. However, I think for the moment, you've probably heard enough of me talking about what our options are. And I'd like to show you a small film, which is a bit more of an introduction to the health offer within the UTC. So can you play the next film, please?
So when students come to us at UTC, we do 2 different courses. So they start off with doing the Cambridge Nationals in Health and Social Care. that's a 2-year course, and they will study 4 different units with us, a range of different we've got exams, we've got coursework. Then when they've done that in year 9 and 10, year 11 we've got 2 new courses. So we're doing the Cash Level 2 award in preventing and control of infection, and then we've also got the Cash Level 2 award in relationships, sex and health education.
I think the health offer provides young people with experiences and wider knowledge and vocabulary that supports them in interview when looking for apprenticeship and university options.
I chose to come to the UTC because what I'm wanting to do in the future is go into oncology, which is obviously to do with like the medical side. And at the school I was at, I didn't think there was many opportunities for me to go into that.
The aspects I like about the health equipment is that I really like how we get to use it like a lot, and it's not just like a one-time thing.
I feel like I've become more confident with talking to like doctors and nurses and everything. Before I was kind of nervous, but now I feel more comfortable.
I like the fact that the UTC has the links to employers. So in normal secondary schools, you don't have as much contact with people like mental health nurses, people working in NHS, and we actually get a chance to ask them questions that will be relevant to the students, and they can ask them questions, which really helps with their chosen career paths, which they want to go on to do.
I'm really privileged at the UTC to work with some really expert staff in lots of different fields, and that is absolutely true of our health staff. I meant to say, actually, we've pre-recorded some of these sessions and these interviews for 2 reasons. One, really to make sure we can keep this event as concise as possible, and really to make sure you get the key information that's needed. So what I'm going to show now is an opportunity for you to really meet all of the health staff and for them to introduce themselves in a little bit more detail about the course. So if you'd like to play the next video.
I believe that the experience that the children get at UTC studying health is completely different to a normal school. They've got the health-based facilities which they can utilise, and it allows them to get hands-on practical experience.
The health offer at UTC is unique because we have teachers who come from lots of different specialisms, for example childcare, from sports specialisms and from psychology, who can deliver on the course and offer their expertise. We also have support from Sheffield Teaching Hospital. They help us with opportunities in the curriculum, supports for teachers for preparing students to go to university as well.
The applied science really fits alongside the health qualification. For example, in applied science, it really helps you with your lab techniques, having a basic understanding of science, which will allow people who are looking at a health route in the NHS, for example, to really be able to excel in the more laboratory settings which are present in the NHS.
So my particular area of interest in health is nutrition. Obviously it's a very important factor at the minute. It stops a lot of illnesses and diseases, and the more better we get the diet, the less pressure we put on the NHS.
As part of Unit 1, the sixth formers had the opportunity to meet with a professional from the audiology department from the NHS. This allowed them to get an insight into what happens in that department, and it also meant that they could use real-life case studies to use within their coursework.
So a project that students can expect to engage in within the UTC is with first aid. We get professionals in, such as midwives, paramedics, who engage with the students with the teaching aspect of their coursework, as well as actually assessing them, so that they can see how well they do the first aid procedures and they get detailed feedback as well. It's really nice for students to be able to ask the paramedics questions about what their role is and how they deal with emergency medicine as well.
Health is very different at the UTC to a normal school. Our vocational subjects here are very valued, and a lot more resources and money go into making them much more enjoyable and have more practical aspects.
My area of interest within health is the psychology of health. So I like to be able to explain health behaviours and behaviour modifications. So for example, if somebody's smoking, why do they smoke, nature versus nurture, and then being able to provide some explanations and theories to try and change and make them a little bit healthier.
One example of a project that students may work on at UTC is when we did the RO22 communication unit. We had 8 practitioners come in from Sheffield Teaching Hospitals, and they set up what we call a communication carousel. It was a variety of activities where the teaching hospital staff assessed their students' communication skills.
That's it is really a privilege. Later, you'll also hear from Shauna Sleaford, who is the curriculum director from Health, who was in the first video, but not the second one. Most important to my school, and the thing that makes me most proud, is our students. And it was a real pleasure interviewing them, actually, and a real privilege to interview them for this virtual event, because I don't often get the luxury of sitting and talking to them truly about what they like about my school and what are they enjoying and what are they learning in the way that I did in order to record this. We are a small school, and that means that we get to know our students really well. We've got just under 420 students here, so all of our staff know all of our students by name, and it's got a really strong community feeling. So I'd like you to hear from our students themselves what the health offer is like.
I would definitely recommend the health and social care at UTC because it's extremely versatile. It talks about a whole range of factors which all fit into health and social care. I also feel like it really prepares you for whatever health and social care career you want to go into after UTC.
The school's also so facilitated to doing our subject and much more. If you see the health base, you'll know what I'm talking about. It has a range of equipment for us to do our subject, and it has a lot of models, so when we're doing subjects such as anatomy and physiology, we can actually see what we're doing, and then it helps us and it makes the subject easier.
It's a good school for specialisms. If you want to go into health, it's the best school you can really go to study what you want to do.
It opens opportunities for people.
We're doing a research method, which is about finding research using it. We're doing the mental health topics, so learning about schizophrenia, which links into the psychology lessons.
I think it's a bit different because it looks at the medical side, it looks in enough detail, and it's different to other schools that I've been, and it's so interesting to study it.
I just find it really good from the point of view that it's specialised in it, so you're called a health student. I just find it really makes me feel like I know what I'm doing, and it gives me a goal for the purposes I want in life. Also, it looks a lot into the careers and what you could actually go into in different universities. You can look at the careers you want.
Some of us got offered the chance to do work experience in hospitals in general. So for the Northern General Hospital, I got the chance to work in day surgery and got to take people's bloods and stuff like that. It was amazing.
I'm currently studying anatomy and physiology, legislations and building positive relationships. With the legislations one, I like it because I feel like I know my rights more, and it makes me feel more comfortable when I'm doing other things outside of the school.
I found actually the first aid course was one of the best things that we did in health, because there's a lot of practical, but also it's just really helpful life skills in general, even if you don't go into a job which is specifically health. And the body systems one, actually understanding how your own body works, is always a lot of fun to learn.
Other than health, I also study biology, psychology and English literature. English literature is a subject I really enjoy, and psychology is another subject I find really interesting to learn about. Also, I feel like quite a lot of health does link in with biology, which is really great.
Yeah, I study biology, chemistry and psychology alongside with health. It's really great because all the subjects fit so well with each other.
Alongside our students, we work with employers, and within health, often that's the NHS or care providers. It's also the university. So here's an opportunity to hear from one of our partners to talk a bit about that.
My name's Belle Fletcher. I'm a Senior Schools and Colleges Engagement Officer at Sheffield Hallam University, and my role is to help prepare and support school and college learners thinking about applying to higher education. Sheffield Hallam University, we really value vocational learning. Our own courses are applied, having some kind of work experience-based learning opportunity, placements, and we deliver projects that focus on real-life problems. So students that complete vocational courses have the opportunity to gain that insight and experience, which really sets them up for completing a degree and going on to work successfully in the jobs market. Courses at UTC are developed and structured with the input from health and social care professionals across the region. Having that expertise when developing the courses ensures that their content is current, up-to-date and relevant. This means that learners can adapt to different circumstances using the knowledge and experience they've gained throughout their course. They get an insight into what it's like to be a health professional, which is really important when applying for a course to become a practitioner. The health and social care sector is under immense pressure, especially at the moment due to the pandemic. We need learners who are passionate about working in health and social care to start on programmes like the course at UTC to gain the skills and develop their knowledge and experience, to gain a place on a degree programme and then work within the health and social care sector. Completing a course that is practical and underpinned with the values of the NHS enables learners to understand what it really takes to work within this area. Work with the UTC to design the courses, offer support with project work and help students to gain an insight into the careers and opportunities available within the health and social care sector. In a lot of cases, people are only aware of a small number of professions like being a nurse or a doctor, whereas there is such a wide range of courses and specialties you can find out more. Our role is to showcase those opportunities and help advise and guide students to be successful during the application process and during the course itself.
I'm extremely proud of the destinations that our students go on to. I mean, certainly last year, I think was one of the most difficult years to be a year 13 as the pandemic caused school closures. And what I can say is that all of our year 13s were able to secure destinations on courses that they wanted to do or apprenticeships or into employment. We are extremely proud of our record of making students who are not in education, employment or training, in that all of our students over the years have not been neat. So I've put that a funny way. So they've all gone on to really successful destinations, some of which you can see that are there. Certainly what was touched on the last video is one of the things that we make sure we do in all our specialisms, but particularly in health, is expose students to the diversity of roles that are available. Because when you talk about health sciences, when you talk about social care, when you talk about all of those, you're actually, even just within nursing, you're talking about multitudes of fields of different possibilities of employment and role type within that. Certainly only last week when we were talking with one of our employer partners, we were talking about the diversity within nursing, from digital nursing through to nursing with elite sports, through to adult mental health nursing. These are all incredibly different roles. What we aim to do is to really allow exposure to those, to what those different possibilities are and all of that, and help students to really think about what it is they are interested in, underpinned by the knowledge that they are provided within the curriculum. 75% of our students go on to university, which is a high percentage. Lots of them go on to Russell Group universities, but our focus is absolutely about getting students onto the right next step, be that from year 11 into post 16, or from post 16 onwards into university or into employment or into more and more apprenticeships which are coming up through the healthcare sector. What we want is confident young people who are going on to a career in which they're going to thrive and succeed. And that we are feeding gaps in the employment market and really matching those two parts of the jigsaw puzzle. In relation to that, I'd like our next video is one of our alumni who we're really proud of, who has come back and wants to talk about what it was like to study at the UTC.
So we did, yeah. We went on a few visits to the Royal Hallamshire Hospital, which was very beneficial to me because I wanted to do adult nursing. So it was very beneficial for me to like go there and have a look around the hospital. And we also had an employer engagement event with the Director of Public Health for Sheffield. And public health is something that fascinates me. I love public health. It just interests me so much. So from that session actually stemmed my work experience placement, because I decided after attending that event, I wanted to do my Year 12 work experience, shadowing the Public Health Director for Sheffield. I have always wanted to work in the health sector. It's the idea of helping someone when they're most at need, using your skills to proactively encourage a patient to engage with their recovery, the enormous level of job satisfaction that comes along with the health sector. So at the minute, I'm currently studying for my adult nursing degree at the University of Leeds. So that was something that I knew I wanted to do before coming into the UTC, but studying at the UTC, it sort of like finalised that and 100% made my mind up of, I do want to do adult nursing. So I'm currently a first year adult nursing student at the University of Leeds. I would say there has been a lot of crossover between my UTC work and my degree work. So like this morning, for example, in my tutorial, we were talking about medicines management and how we would deal with someone who doesn't have the capacity to give informed consent for that medication, of what we do. And through things I learned at the UTC, such as the Mental Capacity Act and advocacy and things like that, I was able to make an informed contribution to the tutorial thanks to the knowledge I gained. Oh yeah, definitely. It introduced me to the realities of working in the healthcare sector, and there is a lot of crossover between the work you will do at health and social care and what you'll study in your healthcare degree. There is a lot of crossover, so I feel like that prepared me very well. But also the time management, the organisation, the academic writing, I feel like that's also helped me a lot.